You're listening to the voice of the Blue Eagle.
You know what it is?
Ateneo Campus Radio.
Radyo Katipunan, 87.9.
Listen to songs and artists you didn't know you'd like. This is the Indie List on Radyo Katipunan 87.9 FM.
Blue Eagle kami di mapipigil sa pagbabalitang tumpak at tama. Buhay Atenista sa loob sa labas ng eskwela, ating ibibida lahat ng eskwela. Radyo, Katipunan, Radyo, Katipunan, Kawal ni Ignacio, sugo, todo sa kayod, punong at tulong. Lipad na Blue Eagle, galing giting at gigil. Blue and white, one big fight. Radyo, Katipunan, Radyo, Katipunan,
Coming up next, Cura, conversations on care, health, and healing on Radyo Katipunan 87.9 FM.
Radyo, 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 Katipunan, Radyo, Katipunan, Radyo, Katipunan, Radyo, 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 Katipunan, Radyo, Radyo, Katipunan. Voice of the Blue Eagle, kami di mapipigil sa pagbabalitang tumpak at tama. Buhay Atenista sa loob sa labas ng eskwela, ating ibibida lahat ng eskwela. Radyo, 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 Katipunan, Radyo, 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 Katipunan, Radyo, Katipunan, Radyo, Katipunan. Kawal ni Ignacio, Katipunero, sugod, todo sa kayod, tulong at tulong. Lipat na Blue Eagle, galing giting nagigil. Blue and white, one big fight. Radyo, 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 Katipunan, Radyo, 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 Katipunan, Radyo, Katipunan, Radyo, Katipunan, Radyo, 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 Katipunan.
Health isn't just about medicine.
It's about care
Community
and conversation. That's why Radyo Katipunan brings you Cura, your campus medical show.
From everyday wellness tips to expert advice on the health issues that matter most to you.
Cura is here to listen, guide, and care
The Ateneo way.
Join us as we talk about healing
Hope and health right here on
Radyo Katipunan 87.9 FM. Cura, your campus health companion where care meets conversation.
Magandang gabi, Ateneo, and welcome to Cura, Conversations on Care, Health, and Healing. I'm Dr. Tipi Sumpayco Tanchanco.
And I'm Dr. Jello Apostol, and today we're tackling a topic that affects millions of Filipinos, asthma. And Dr. P, this is something that is very special to me because I have asthma. I had asthma growing up. And as an environmental health researcher, when we think about the air that we breathe, the spaces we occupy, and our changing climate, all of these directly impact people living with asthma.
Yes, absolutely. Oo nga. Ako rin yung bunso kong kapatid, may asthma, ninang ko, may asthma. Parang ang dami talagang affected by asthma, no? And what many people don't realize is that asthma is not just one condition. It's actually a spectrum. We have people with mild, occasional symptoms. Others will have life-threatening attacks. Some develop it in childhood. Iba naman, matanda na, adulthood when they have it. And in the Philippines po, with our unique environmental challenges, so pollution, high humidity, allergens, smoke, asthma management requires special attention.
Lalo na nung bagong taon, Doc TP, di ba? Kasi ang daming paputok. So, alam ko,
Sakto rin pala to kasi halos New Year pa lang, right?
Yes, no? And today, we have an exceptional guest, Doc TP. We have with us Dr. Shell de Vera de Quiros. Hello, Doc Shell.
Hi, hello. Hi, Jello. Hi, Tippy.
Hello.
Hello to everyone. Thank you for having me. I'm so excited because, asthma is near and dear to my heart. It's also so pedestrian. Diba? Like you said, you have asthma. Your family members have asthma. So I think it's such a timely topic.
Right. Pakilala natin si Doc
Yes,
Shell.
alam mo, sobrang sakto ng guest natin today because Dr. Shell is an allergologist-immunologist, which means she's the expert on asthma and allergies. She's also one of our assistant professors at the Ateneo School of Medicine and Public Health and is a consultant at the Medical City. And she has published extensively on these topics.
Researcher din si Doc Shell.
Yeah, no? So lahat, no? Parang 3-star, 5-star physician. Diba? So if you or someone you love has asthma or you suspect you might have asthma, this conversation will really be valuable to you.
Right. So we'll cover what asthma really is, how to recognize it. Syempre, kailangan alam mo, inihika ka na pala, no? When it's an emergency, how to manage it day to day, and important, ito po pinakamahalaga, how to thrive with asthma. So, hindi lang survival yung habol po natin dito, no? Because the goal isn't just avoiding attacks. It's living a full, active life without limitations. Ayan, Doc Jello.
So, Doc Shell, ako I'm interested. In your practice as an allergologist-immunologist, do you mostly see young kids or mostly adults, or do you see people across the lifespan?
Because the specialty asks for it, you really see we're like children to adults, which is nice because then we get to see how the disease progresses, the different manifestations of the disease. So we see both. So in my practice, it's both. It's like half kids, half adults.
Ako, curious ako dito, Doc Jello. Question ko kay Doc Shell, bakit ka naman nag-allergy and immunology? Anong kwento dyan? Paano ka napadpad dito sa field na to?
Kasi nerd ako.
Agree ako doon. Sobrang nerd talaga po si Doc Shell. Ayan,
So,
go.
I guess when I was in residency, so I'm one of those people na, ngayon ang uso na word, di ba, parang rule in at rule out. Like, what would you do as when you wanted to do fellowship?
Pagpipili ka.
Di ba, mamimili
Right.
ka kung anong fellowship mo. And so when I was looking at it, first, I wanted to see, like, in terms of, like, what the needs of where I was gonna serve. And since I was gonna come back to the Philippines, sabi ko, what's the need? And there weren't a lot of people who were doing allergy-immunology. And I figured, technically, it's the immunology part that like drew me to the specialty.
Yung science talaga, yung
science,
nerd part
the nerd
talaga.
part.
Yung hard science.
So that one I like. And then, I figured, because immunology was such a great subject, and it was actually involved in all the other diseases, whether it was heart disease or diabetes or endocrine, and then allergy. So I figured that was such a great thing to get into. So yon. So and then I had a mentor who I really, really liked, and she was an allergist-immunologist. And then, I get inspired when people are great teachers and they impart really well and I work with them well. Allergist-immunologist siya. So, na-hard recruit ako. So yun. Nagpa-recruit naman ako.
Kaya pala great teacher din si Doc Shell ngayon sa ating mga med students sa Ateneo, no?
And ang powerful, no? Kasi iniisip ng ibang tao, pag allergology, parang, allergic ka lang siguro sa dust, gano'n. And that's it, di ba? Parang, but what Doc Shell is saying is that it's actually related, like allergology, immunology, to other things that are happening in your body, right? No, Dr. Shell?
Right. True.
Inflammation talaga, no? O ito, basics muna, Doc Shell. So, ano nga ba ang hika or asthma? What is asthma? Because I think many people use the term without really understanding what's happening in their lungs or in their body. Ano nga ba to?
So, I think you're correct. Ang piniisip kasi nila pag asthma lang, nahirapan huminga. Like parang nagsasara lang yung airways. But that's not true. So, it's really a combination of a few things. Number one, Tippy had talked about, used the word inflammation. And that's really basically the root of it all. So, it's an inflammatory disease. So, ang nangyayari, the airways, dun dumadaan yung ating, di ba, when you breathe, di ba, the air will go, yung hangin, it will go into your lungs, your upper airways, tapos lower airways. Yung airways mo, namamaga. So, maga siya. So, dahil maga siya, so imbes na big yung daanan yung air, nagiging smaller kasi maga yung walls ng airways mo. So, that's really, really the crux of it all. Yun ang parang underlying problem niya. And then, it makes also, because of the inflammation and other external factors, your airways become twitchy, parang madali siyang ma-irritate. So, naggaganon siya, nagko-constrict siya. Nagko-constrict siyang ganon, di ba? Magana nga siya. Tapos, magko-constrict pa siya. So, di lalo kang hindi makaka-exhale, mas mahirap yon. And then, lastly, and again, inflammation is a problem, you produce more mucus. Kaya di ba sasabihin ng ibang tao, parang ang dami-dami kong plema. That's where that whole thing about plema sa baga, I think, comes in. So maraming mucus production. So again, ang liit-liit na nga, mabablock pa siya ng mucus. So it's really an obstructive disease.
So ang galing ako kasi iniisip ng ibang tao, pag asthma, nahihirapan lang huminga. Pero actually, ang dami palang nangyayari, no, Doc Shell? Parang sumisikip, namamaga, tapos nagkakaroon pa ng mucus. So I guess all of those things make it difficult to breathe.
Right. So yun yung end result. Like it's hard to breathe. It's basically also hard to exhale. So that's actually the problem with asthma. Hindi ka maka-exhale well. So like your lungs just the airways get like parang bigger and bigger. There's no more place to get better air in. Parang ganun.
So hindi makalabas yung hangin. Ako naman, Doc Shell, as an environmental health researcher, gusto kong malaman parang how does the environment factor in when we talk about, developing asthma symptoms? Parang malaki ba yung factor ng environment or is it mostly, kasi marami na naniniwala, pinanganak kayo na may asthma eh. So baka mas genetic ba yan or mas environmental ba siya, Doc?
So, the predisposition to have asthma, kasi majority of patients who have asthma are also allergic. So they have other allergic diseases. That's not always true. But malaki yung role ng genetics. So because the genetic predisposition to get the disease is there, so it's partly genetic. But it cannot be just genes alone.
Right.
Like a lot of things, di ba? So the environment, the external factors play a huge role. And it's not just allergens. Angelo, it's right down your alley, di ba? It's also like all of these pollutants, the things that add on to like bad air quality, etc. So all of these things, they all play a role in how you get triggered to have asthma attacks.
Ano ba yung mga common triggers, Doc Shell?
So pag allergens, syempre environmental allergens yan. So things that you can inhale. So what are these things? Dust mites. In the Philippines, not so much pollen because we don't have seasons. So wala tayong parang surge, parang like in other countries, di ba parang
pero
may spring.
Si
di ba,
Dean
parang
Dodi daw may kapok season
Yes.
sa Antipolo.
Ano ang kapok?
Kapok is like, it's like
Parang
the cotton.
Yeah.
Because you're young, you've never had kapok.
Pero nakikita ko
So
yun
siya
eh,
na
yung
yung
mga...
laman ng unan mo.
Unan dati, nung
Parang
unang panahon.
Yung puno yun na parang may cotton yung fruit, no? Kapok
Correct.
pala ang
So kung marami nun,
tawag
tapos
doon.
allergic ka doon, that's one possibility. So pollen is one. And pollen, when you talk about pollen, trees, grass, mga ganyan.
Tapos na-inhale ba? Kailangan ba
Inhale siya.
na-inhale?
Kailangan ma-inhale. So how it
Okay.
gets into you need to inhale it. Kasi inhalant allergen siya, di ba? Molds, very, very, it's not just toxic. Di ba? Molds by itself, even if you're not allergic, can be toxic. But it's also, if you're allergic to it, parang double whammy. Parang gano'n. Cockroach droppings, animal dander, dogs, cats, horses, mga ganyan.
Horses din.
Kung may horse ka, may pony, mga yan.
Ang social naman.
Kung social ka.
Okay. Ang alam ko,
Mga ganun.
EPs, like si Doc
EPs,
Angel
yeah.
and EPs. Like, okay.
Doc, how about yung mga parang temperature? Like, masyadong malamig, masyadong mainit. Kasi
Yes.
ako, personally, natitrigger yung asthma ko kapag sobrang lamig. Is that asthma or is that a possible trigger kaya, Doc?
So triggers, when you say the word trigger, just as the name implies, it triggers an attack, right? You already have the disease, eh. You already have the disease. Like, you cannot, if you don't have asthma and you don't have the predisposition for it, no amount of cold air will
Kahit bugahan
give you
ka.
asthma.
Okay.
Diba? No amount of like, dust, hatching ka kasi it's dirty, but it won't give you the disease. But if you have the disease, certain things can make you have the attack, can make you have the flare. So,
Right.
the non-allergic triggers include cold air, kasi we're not supposed to breathe cold air, diba? It's very irritating to your airways. Stress, which is our favorite thing
Even
to
stress can induce asthma.
Hikain,
Yes,
stress, kung may
yes,
exam,
yes.
biglang
So
hikain
pag
ka na.
maraming estudyante na may asthma, pag nag-aaral sila or like boards or like, things like that, so they get an asthma attack. So you want really to make sure that they're controlled kasi kawawa naman, magbo-boards na nga, asthmahin pa.
Hikain mo
Barometric pressure, pollutants, smog, ano ba? Menses, hormonal shifts.
Even hormones
Yes.
can
Pag
trigger.
When you're pregnant, when you
Okay.
have things like that. And that's not true for everyone, ha? It's not the same. It's not like, because you have asthma, all of these
This will
things will
happen.
trigger you, to trigger your asthma attack. Some people don't have this particular problem, but have this particular problem. So I guess like everything, like all diseases, it's never one size fits all. It's never decahon. That's why it's important to talk to your patient. That's why it's
Right.
important to see your
Right.
doctor. Diba? Parang
Yeah.
ganun.
So, Doc Shell, pag-usapan natin, ano nga ba yung classic symptoms of asthma? Kasi I think yung ibang mga nakikinig din, hindi rin nila alam, o kaya konting ubo lang, hika na ba yun? Like, what are the classic symptoms?
So the biggest clue for asthma is recurrence because
Okay.
it's a chronic disease. So kunyari one time, nag-wheeze ka, never again, parang hindi yata asthma yon.
Okay.
It's really recurrence, pabalik-balik, paulit-ulit. If that's the kwento, pabalik-balik po akong hinihingal.
Ilang beses para sabihin mo na, hika nga yan?
That's harder to answer,
Okay.
pero generally, months. Diba?
Na paulit-ulit.
Paulit-ulit. Or like in a year, 4 or 5 times you're getting attacks of difficulty of breathing. That's a problem. It depends also on how severe the disease is. So there are some people who just have cough, especially in children. Cough lang na recurrent, paulit-ulit, especially at nighttime, that might be a symptom of asthma. Obviously, difficulty of breathing is like, diba? It's like the quintessential asthma symptom. Difficulty of breathing, wheezing, like when they hear wheezing. Or if your doctor listens to you and there's wheezing. Breathlessness, like I'm always hingal. Or you can't, if you're a child, di ba if you're a child, you should be able to keep up with your playmates. So, kunyari, konting takbo lang, hingal ka na all the time, baka asthma. And we're not saying that it's always asthma because there are other things that you have to look at. But these are signs and symptoms that you might want to look at.
Right. So, pwede bang inuubo, walang wheezing, pero hika pa rin?
Yes, pwede.
Pwede yun.
Pwede yun. It used to be called cough variant asthma, pero di na siya tinatawag na ganun ngayon. Kasi parang dinidiminish yung pagiging asthma niya. So, as
So,
everything
asthma is
else,
asthma.
asthma is asthma.
Yes.
Dok, yung wheezing, no? Parang, kasi it's a very medical term, no? Parang, for a lay person, parang
Ide-demo mo ba?
Hindi, actually gusto kong tanongin kung pwede i-demo ni Doc Shell, di ba?
Ganon.
Ganun ang
Yung
bad
ganon.
asthma. Pero ang wheezing, parang whistling sound. I guess that's parang yun ang
Parang
pinaka-best.
sumisipol.
Parang sipol, yun.
Oo.
Parang sipol. Or yung ibang patient, sabi lang, humuhuni daw. But I don't know what that means eh. Pero basically, it's a high-pitched sound siya. Parang ganon.
Kasi kapag hingal, parang mababa
Yeah,
yung
oo.
pitch. Pero pag
Correct.
wheezing, parang it makes sense kasi sinasabi mo nga kanina, Doc Shell,
masikip
sumisikip. So parang, yun nga, pag masikip, mas mataas talaga
May
yung
sipol
pitch.
talaga,
Oo.
no? Oo. Yeah. Okay.
So, hindi lang pala siya sa mga ka-breathless po natin, di ba? Parang, di ba uso kayo may mga ka-breathless, di ba? So, hindi lang siya breathlessness. Parang may mga classic symptoms pala.
Right.
na kailangan nating bantayan. Oh. Sige. Doc Shell, pag-usapan naman natin through the age groups, no? Like, iba ba ang presentation ng asthma sa mga bata compared sa mga adults or seniors? Or pareho lang ba to?
I think ang mas important na question is, iba-iba yung severity. So, iba-iba yung symptoms depending on how severe you are. Because some kids have really severe asthma. And some adults have mild asthma. So, then the symptoms will be different, but it's really looking at how severe the disease is. Yung age lang, kasi nga, in kids, di ba, it's harder for them to describe. Like, di ba, if you have like a 5-year-old or a 6-year-old, baka mas mahirap nilang i-describe yung difficulty of breathing.
Okay.
Parang ganon.
So, ano yung babantayan?
So, coughing, play, watching them when they're playing. Are they the people na, because di ba at that age group, di ba, they're in elementary school. So, di ba, this is also the age group na ang dami-daming viral infections. Yung viral infections mo ba naglilinger, parang tagal-tagal mo nang umuubo. It's not unusual to have a viral infection kasi nahawa sa class, di ba? Lalo na now, oh my
Uso
God.
yan.
Usong-uso ngayon yan, di ba? Ang dami-daming may viral infection. Pero itong batang to, oh my God, it's like, 2 buwan na, 3 buwan na, ubo ka pa rin ng
Non-stop.
ubo, non-stop. Tapos, so that might be something that's a clue as well.
Doc, so you mentioned that there are different severities of asthma. Paano ba yun, Doc? Parang is it based on the frequency or gaano ka ba ka-breathless? Based ba siya kung gaano kataas yung pitch ng wheezing? Parang, I guess, I know for doctors, parang alam nila kung ano yung, how to classify yung severity. But I guess for our lay people, how might we simplify their understanding of the severities of asthma, Doc?
So the current way to classify asthma is by there's two main categories. One is that it's either intermittent or the other one is persistent. Pag sinabing intermittent, as the name implies, intermittent, pasulpot-sulpot lang siya. Minsan lang sa isang taon, that's when you get your symptoms. And then there's no limitation of any sort of activity. You can do all sorts of things. Pero maybe like once a year, you were saying ganyan, parang, pag maraming paputok, kasi ang pangit-pangit ng air quality, doon lang ang asthma hen. So it's very, very rare that you get the symptoms. But the persistent asthma is more, as we said, pabalik-balik, paulit-ulit. So it's a little bit more chronic. And that one, you can either have mild persistent, moderate persistent, or severe persistent. And when we say mild, that's less than 2 days that you have symptoms in a week. So, tapos your activities aren't bothered. Like you can sleep, you can work out, diba? You can walk up and down the stairs, mga ganyan. You don't need a lot of there's a medicine that people use to like help them breathe, diba? It's called the rescue medicine, and we can talk about that later. You don't need that. Moderate, a little bit more, so more than twice. Not daily, but certainly more than 2 times a week, you get symptoms. And sometimes you get a little bit problematic with your activities. Like if you exercise, before I used to run, 5 kilometers, pero now I can only run 1 kilometer. Parang ganon. There's some limitation. And then obviously severe, it's more frequent. Almost daily, you're getting attacks, you're needing a lot more medicines.
Yeah. Doc Shell, curious lang ako, clinical diagnosis ba to? Or meron ka bang diagnostic tests na pwedeng gawin para sabihin, sige, hika yan talaga or asthma yan talaga?
So you start out, because we're all doctors, di ba, we start out with story, like kwento. What's your history? Ano nangyari sa'yo? What are your signs and symptoms? And then, what's your family history? Kasi di ba we said nga, genetics plays a role. So, is there a strong family history of being allergic? Not just asthma, pero lahat ng pamilya ko merong allergic rhinitis. Or lahat kami merong skin allergy. Basta marami sa pamilya. Then that's a clue as well. So, looking at the patient's history, the family history, other past history that this patient has. And then, if you're a little bit older, there is an objective test called, it's called the spirometry. It's like a breathing test. So basically, you go to the lab and they ask you to breathe in this little tube. And then, marami lang instructions. Hindi siya masakit. Medyo mahirap lang kasi parang take a deep breath, blow hard, blow long, mga ganyan. Marami lang instructions, so you have to follow the instructions. But that's a really great objective way of looking at lung function. Tapos from there, plus your history. Kasi di ba parati namang dapat connected, di ba? Yung kwento at yung lab. Tapos, that adds more information. But it's a really good objective way to say, baka mukhang may asthma itong kwentong, itong pasyente na ito.
Yeah.
Pero parang even just listening lang pala to the story, no? Especially if may mga kamag-anak ka.
Yeah.
Pag sa experience mo ba, Doc, na parang kapag may nanay or tatay ka na may asthma, parang malaki ba yung chance na talagang maipasa yun sa kanilang mga anak?
Namamana ba siya? Ganun.
Namamana ba siya?
So
Parang very strong ba?
Very strong. So yung possibility to become allergic, the allergic manifestations or the allergic diseases, namamana eh. If one parent is allergic, there's a risk of about, depending on the population that you look at, there's a risk of about 40%
Sa Filipinos yan.
sa Filipinos. Kasama ng Filipinos. So, merong mga studies, mas marami pa ring studies obviously in North America and European countries, pero sa atin, nadadagdagan. So, about 40% the possibility of making mana the allergy. Not necessarily asthma, pero yung pagiging allergic, mataas. If two parents are allergic, oh my God, ang taas, parang 80%.
Biglang nag-shoot up yung chance.
Yung chances. Pag parehong allergy, mas mataas pa. Kunyari, mommy asthma, daddy asthma, oh my God, ang laki-laki ng chance na magka-asthma yung bata. Pero like, kunyari, mommy asthma, daddy food allergy, mataas pa rin, pero not as high as asthma. So I guess it's important, again, we said, to ask, di ba? Anong meron yung pamilya mo, etc.
Parang applicable ba yung pag makikipag-date? Kasi kunwari ako, asthmatic ako, tapos makikipag-date ako,
Mamimili
parang,
ka ng hindi
may asthma ka rin ba? Kasi
Ako, game. Ako, I'm sorry. May asthma ka rin. I'm sorry, honey. I love you. Pero we cannot be.
We cannot be.
We cannot be.
Meron
Hindi
palang
pwede.
ganong criteria. No?
merong questionnaire.
At least may
may,
questionnaire.
may disqualification criteria.
Kawawa.
So, umpisa pa lang, alam mo na dapat. We cannot go on.
Pero ito, Doc Shano, just to also bring it back, kasi I'm particularly interested on environmental health. And we know now na, and before the show, no, you were talking about like before, hindi naman masyado ganun kausok sa EDSA, for example. And yet now, di ba, parang the amount of pollution that we are exposed to, and of course, we have climate change pa. I guess it's another question, di ba? Parang, does climate change affect how common or how likely it is that people are triggered or their
Dumadami
asthma?
ba yung may hika ngayon?
Based sa practice mo, Doc, parang mas napansin mo ba na mas dumadami ang nagkaka-asthma ngayon or yung natitrigger?
Worldwide, yes. Not just asthma, but technically allergic disease. But asthma being one of the more parang serious, di ba? And I'm not saying that the other allergic diseases are not serious. Pero asthma kasi you cannot breathe eh. So if you cannot breathe, it
It's
can be
scary.
lethal, di ba?
Yes.
Parang ganon. So yes, so worldwide, not just in the Philippines, if you think about it, even countries, in fact, na hindi naman ganito ka bad yung air quality, worldwide, nag-i-increase talaga yung incidence and of people who have asthma. And it's not just because, like all diseases, di ba? Now kasi we can diagnose it better, mas may alam na tayo, mas mataas yung suspicion natin. We have better tests, but truly, even without that, there's really an increase in the amount of people with asthma. And climate change, I mean, really, like, there's nothing good to say about climate change, diba?
Tatanungin natin si Doc
Diba?
Jello
Si Jello
dito.
makakasagot nito lahat. Pero there's really nothing good to say about it. But even more so with respiratory diseases. Kasi, so let's say, so the pollen season changes. Nagiging longer, for example. So then, if you're allergic to pollen, dati nun, parang 2 months lang ako exposed. But now, longer. Ozone, diba? Which
yung
increases
ground level ozone.
Correct, diba? Particulate matter that you inhale, these are triggers for asthma. Mas marami ng, speaking of flood, I know it's a controversial ngayon, bagyo and flooding, it makes molds. Kasi diba, your house is always flooded,
Right.
molds, damp,
At tumutulo
yung bubong mo.
Yeah.
Diba? Ang tagal-tagal ng tubig, parang ganon. So, magiging moldy yung environment. Molds is mold spores. Inhaling mold spores are trigger for asthma as well. So, all of these things, they're all, diba? Our world is connected and we're all connected.
Yeah.
So, if the environment is such in bad shape, we're gonna suffer from it.
Yeah.
And they can be worsened by climate change. Kasi nabanggit
Yes.
kanina ni Doc Shell, no, yung ozone, for example, typically dapat it should be at the higher
Higher
levels of
level.
your atmosphere kasi it protects us from the rays of the sun, but
Right.
because of warming climates bumababa siya, yung tinatawag natin na ground level
Right.
ozone. Tsaka
Okay. And no
yun na-
effect nun?
Yung
Yan,
parang
matitrigger
ozone is
talaga.
really an irritant.
It's an irritant.
So I guess it's one of the, nabanggit nga kanina ni Doc Shell, no? One of the chemical triggers of
Right,
asthma. And of
right.
course, molds. Yung molds talaga, no? Lalong-lalo na yung mga bahay ng mga Pilipino, kadalasan gawa sa kahoy.
Yes.
Diba? So, kung nabasa yan,
yeah.
talagang pwedeng magkaabag.
And we're so damp. Diba? Ang humid natin. Tapos ang ulan, diba? It rains. Now nga, there's no more rainy. Diba? When I was younger, like, may rainy season talaga. Tsaka,
Summer.
summer.
Oo.
Tapos a lot more demarcated. Now it's like
Wala.
raining.
Kahit Pasko may bagyo.
May bagyo.
merong
So
ganun,
it's always
diba?
damp. And then
oo.
outside, it's always damp. So the soil, and it's not just indoor molds. It's outdoor molds.
may outdoor molds din pala.
Right.
Yes. So nakikita natin, hindi lang siya talaga individual issue. It's really a public health crisis na ngayon. And syempre, yung environmental factors na nakikita natin, kailangan natin siyang malunasan collectively, no? Yun yung
And
challenge.
I think equity issue din, no? Kasi siguro gusto ko rin tanungin at this point na Doc Shell, parang may mga nagsasabi kasi, yung asthma pang mayaman lang yan. Sakit lang daw ng mga mayaman kasi kapag mahirap ka, tapos nahirapan ka huminga, nag-iinarte ka lang daw. Parang, can you I guess, parang totoo ba yun? Parang pang mayaman lang ba? Or, kaya nagka-asthma yun kasi parang, hindi siya na-expose sa maduduming
Nung bata siya.
environments
Oo
yung
nga,
bata.
no?
So,
Tama.
pang mayaman lang daw siya. Totoo ba yun, Doc?
I guess kung mayaman ka, mas diagnose ka kasi nagpapatingin ka sa doktor.
Ayun, oo.
Di ba?
Iba
Parang
yung
ganun.
health-seeking
Kung mayroon.
behavior din.
So, but I think nga, speaking of equity, mas lugi pa nga the people. We have to worry about because if you think about how asthma is diagnosed, for example, then you have to go to a specialist, right? Yung tests na sinabi ko kanina, they're not inexpensive. Diba? You have to go to a special hospital. Hindi lang siya pwede sa maliliit na hospital. So you have to go pa somewhere else. The medicines for asthma are not inexpensive either. So, in low-resource countries or communities that don't have this, mas lugi talaga sila. So, hindi naman sa pangmaya, mas lugi pa nga sila kasi may asthma pa rin sila but they're not treated as well. They're not diagnosed as well. And as Tippy had said, the whole point is not just to prevent attacks. Pero di ba, you have to, di ba, you have to live well despite having the disease.
Puntahan nga natin, Doc Shell, yung treatment ng asthma. Paano nga ba tinitreat ang asthma?
So, there's two kinds of treatment. One is, so again, di ba we talked about kanina about the categories, di ba? Intermittent at saka persistent. If you have persistent asthma, that one needs to be treated better. Kasi intermittent, like once a year. Then you can focus on that month and then treat it. But the rest of the year, you're totally great. Then you might not need specific medicines for that. But if you have persistent asthma, that means mas madalas kang magka-attack. So the two medicines that you can use are number one, they're called preventive medicines. So and as the name implies, it's supposed to prevent attacks. So we don't wait until you're having an attack and then just give you the medicine. So the idea is so that you can do whatever you need to do, sports, school, singing, whatever. Exams. Because I cannot change the world, I need to make sure that even if the world changes, I'm not gonna get attacks all the time. So that's what the preventive medicines will do. And that one, there's two ways of doing it. Dati nun, the evidence was just really lang, dapat lang talaga every day, regardless of whether you have attacks or not. But recently, there's some good studies na pwede ring as needed. But but you need to talk to your doctor about it. Not everybody will be able to, sige, hintayin ko na lang magka-attack ako. But the kind of medicines that you're using are generally inhaled steroids because, as we said earlier, di ba, the root cause is inflammation. And if that's the root cause, then the gamot has to be anti-maga, anti-inflammation. Steroids are the best anti-inflammatory medicine that
So,
we
siya
have.
na yung first line for asthma.
Siya yung first line for persistent asthma.
Persistent asthma.
And then, there's a drug naman that's called rescue. Kasi 'di ba, even if you have maintenance medicines for whatever disease, kahit na diabetes or hypertension, like all of these chronic diseases that you use maintenance medicines for, there will be a day na parang hindi lang ako as well controlled. For what, 'di ba? Well, for whatever reason, you get triggered by this, etc. So dapat meron ka ring pang rescue. So it will rescue you from this
Just in
attack.
case atakihin ka.
Atakihin ka. Pero dapat, because nga, we're so good about preventing it by you using your preventive medicines, dapat less and less and less mo na ginagamit yung rescue medicine mo. In fact, the amount of rescue medicines that you use is a good gauge kung gaano ka controlled ang asthma mo. Controlled ba siya? Hindi ba siya controlled? Kasi gamit ka ng gamit
Paano
ng
masasabi na controlled na yung asthma?
the amount, again, we talked about like, di ba, how many times in a week do you get attacks or symptoms, not attacks. Kasi sometimes mild yung, kasi yung feeling ng mga tao, pag sinabing attack, kailangan grabe. Kailangan pumunta ka sa ER, kailangan mo hospital ka, kailangan parang feeling mo mamatay ka na para masabing attack. Pero sometimes like, hinihingal ka lang. That's an attack. That's an attack. That's a symptom, di ba? Parang gano'n. It's still symptoms and they're not controlled. So, depende sa dami ng symptoms mo in a week. Sasabihan, controlled. Walang symptoms.
So, dapat wala kang symptoms in a week?
Dapat wala kang
As in
symptoms.
zero?
Dapat zero. Mataas na ang ano na. Dati nun, they used to say, okay lang yan. 3 times ka lang naman lang inatake in a year 3 beses ka lang nag-ER, pwede na yan. Ngayon, mababa ang tolerance natin. Once a year na bad attack, that you get ER and you get hospitalized, we're not happy about that. Or let's say, hindi ako nakaka-sports kasi pag nagsisports ako, hinihingal ako. So, nagpapahinga na lang ako. Hindi na yan acceptable. When I was young, I remember, kasi my brother had asthma. Pag magsisports siya, sasabihin na lang, magpahinga ka na lang. Or bawal ka munang mag-sports. Upo ka muna.
Bench ka muna ngayon.
Bench ka muna. Tapos tsaka, pag nakapahinga ka na, sige, maglaro ka na ulit. Ngayon, that's not acceptable. Dapat you should be able to perform at the highest level like everybody else. It's just that ikaw, may inhaler ka, sila wala. Parang ganun. Or you warm up longer kaysa sa kanila. Pero dapat, kung Olympic athlete levels ka, dapat Olympic athlete levels ang kaya mo. Parang ganun.
So, Dok, nabanggit mo nga na for some people, talagang parang asthma medication or asthma management it's really a maintenance thing, no? Parang you really have to take your maintenance medications for asthma regularly. Similar to other conditions like hypertension, diabetes. Minsan may mga naririnig ako, lalo sa probinsya, Doc TV, where I grew up, na parang sabi nila, parang nakakatakot naman yan kasi baka maging dependent ka. Tapos, yung iba sabihin, dapat sanayin mo yung sarili mo na wag kang gumamit ng rescue medication para lumakas yung baga mo. Tapos, syempre, Doc, and I think nabanggit mo nga, some medications have steroids and some people are afraid of steroids kasi nga side effects diba? So, given all of these, I guess, like let's not call them misconceptions. Given these perceptions, Doc Shell, about asthma medications, can you try to shed light on, parang justified ba yung fear ng mga tao about being dependent, about the side effects?
I think for any chronic disease, kasi nga, there's this idea of maintenance medicine, di ba? So I think for any chronic disease, it's a start of like weighing benefits and risks of the medicine, but also, kasama rin parati, what will happen naman if we don't treat your disease with the best medicine that we have? So I think that's always part. Kasi sometimes, nasa stuck na lang yung mga tao sa side effect ng gamot. Hindi lang naiisip, anong side effect nung hindi ko pag-inom ng gamot sa aking sakit? Kasi di ba lalala yan di ba? Lalo na if it's a chronic problem. So, in terms of medicines, if you need it, if your symptoms are persistent, if you're symptomatic every week, if you can't do your daily activities without feeling breathless or wheezing or coughing, then you need your maintenance medicine. The steroids, and rightly so, I think dapat matakot ang tao sa steroids. Tinatakot ko ang tao sa steroids. Dapat lang. Kasi sa Pilipinas, we can get medicines sometimes even without prescriptions, for example. Or we're very good about like, yung kapitbahay ko, binigyan ako Pahiram nga nito, di ba? So, ang feeling ko, madaling makakuha ng steroids sa atin, even though maybe they might not need it. So, I scare people about steroids. And rightly so na dapat silang matakot. That's why that conversation with the doctor and you, if you're a patient, you want to talk to your doctor about it. Ang maganda lang sa inhaled steroid, kaya na-invento si inhaled steroids. Kasi noong unang panahon, before the 1970s, the only available steroids were like tablets and injections. There were no inhalers. But in the late 70s, early 80s, some really smart people said, like, how are you supposed to give these people good medicine when it's so bad in terms of side effects? So, na-invento yung inhalers. So,
Para diretsong baga na.
parang dun lang. Tapos hindi siya mapupunta anywhere else. Well, technically, hindi siya dapat pumunta anywhere else. Tapos, so, you get the power of the steroids na anti-inflammatory nga siya. And yet, you don't get the bad side effects because it doesn't get into your bloodstream. So, that's one thing. So, if you need it, you need it. So, that's a conversation between you and your doctor. So, kailangan yung pag-usapan yun.
Right.
Yung dependence, I think people think dependence and addiction are the same. 'Di ba? Kasi being dependent, kunyari, pwede mo kasing isipin na, kunyari, maintenance medicine, like diabetes or hypertension, you are dependent on that medicine para maganda yung sakit mo.
Para makapag-function
Para makapag-function
ka rin.
ka well, 'di ba? Para makahinga ako, para makalaro ako, para yung sugar ko hindi masyadong mataas, etc. So, you're dependent on it, but you're not addicted to it. Alam mo yun, hindi hahanap-hanapin ng katawan mo yung gamot if you don't need it, or hindi ka mag-withdrawal symptoms kasi addict ka dun sa gamot.
Yeah.
Hindi rin siya parang mawawala ng bisa. Like, di ba, they'll say, kasi wag kang inhale yan kasi pag kailangan mo na,
Wala
hindi
ng
na
epekto.
mag-work kasi wala ng epekto. And it's true for some medicines, but certainly not for the asthma medicine. So they don't
Yeah.
lose their bisa, they don't lose their potency over time.
Right.
So, at hindi ka rin parang sanayin mo siya, parang tiisin mo. Like, tough it out until hindi mo na kaya. Parang nangyayari lang nun, you just suffer kasi nga the disease doesn't get treated appropriately.
So, wag magtitiis. Kapag
Yeah.
kailangan,
Kung kailangan mo ng gamot
Inhale
talagang,
na.
well, pati
Oo.
maintenance,
Pati
no? Kahit na
maintenance.
steroid, pero sabi nga ni Doc Shell, mas safe yung inhaled kesa yung
Kasi ang mangyayari niyan, kunyari, hindi mo siya treat well. Tapos parati kang mayroong atake na bad. Kasi nga, wala kang iniinom na maintenance. So, dahil may sakit ka, this week, meron kang attack. So, mapupunta ka sa ER. Pagdating mo sa ER or sa hospital, bibigyan ka ng systemic steroids, tabletas, tsaka IV steroids or injection, kasi ang lala-lala mo na. Tapos gagaling ka. Pero 2 weeks later, may atake ka na naman. So, bibigyan ka na naman ng steroids. So, parang imbes na mabawasan the steroids that you get systemically, dumadami pa lalo. Tapos,
Right.
it doesn't help pa. Ngayon, parati ka nasa ospital, nag-absent ka sa school, nag-absent ka sa work, ang dami-daming consequences.
Right. Doc Shell, you mentioned, di ba, parang sabi natin, mas mainam yung inhaled, parang naggamot. Paano ba? May proper technique ba? Kasi maraming tao parang, okay, gagamit nito, pero tama ba yung paggamit nila ng inhaler? Or paano kung mga bata, ano yung mga pwedeng gamitin
Yes.
naman kung pediatric patients?
So, I think that's important. So, kung pupunta kayo sa doctor nyo, at first time nyo mag-inhaler, it's important to ask your doctor to parang demo return demo. Also,
Kailangan practicein.
practicein. Ako rin, when I see patients na matagal na hindi ko nakikita, tapos sasabihin lang, the medicines aren't working. My first question is like, tingin nga kung paano mo ginagamit yung medicine.
Kasi baka mali.
So, di ba, may mga inhaler na, yung ganon, yung MDI, yung puffer na tinatawag, di ba? Kung rescue medicine yon, magagamit mo yon. So, even if you're an adult, kayang-kaya yon. But in children, syempre, di ba, there's a technique, di ba? You have to squirt it,
Sasabayan mo pa
inhale
yan
it, tapos
mag-exhale ka muna, tapos para sabay. May timing.
pa.
Oo.
If you're a young child, hindi mo yun magagawa. So, what has been invented, there's what's called a spacer, or the other term for it is an aero chamber. So, it's a little tube that has like a way to trap the medicine inside para the child, pag squinert mo dito, meron siyang chance na i-inhale na hindi
Ang
niya
galing.
kailangan
Several
i-timing.
times na
Hindi niya
i-inhale.
kailangan i-timing. So,
Gano'ng katagal niya iwanan doon?
we tell people mga 10 breaths.
Okay.
Tapos, Doc, umiiyak eh. Okay nga yun. Kasi
Kasi pag umiiyak, mas
hindi naman. Torture eh. No? Umiyak ka! So, parang ganon.
Doon ako balikan ko lang yung side effects. So, kasi naalala ko, ang sinasabi sa akin, kaya daw cheeky ako.
Oo.
Kasi
Tapos steroids.
Kasi daw,
Pisil-pisilin.
so nakakataba ba daw, nakakataba daw, or nakaka-cheeky ba daw yung mga steroids from na ginagamit sa
Not the
gamot sa
inhaled
asthma?
one. Walang studies, walang evidence, walang pruweba na pag nag-i-inhaled steroids ka, makakapasok yun sa bloodstream mo, tapos tataba, mamamanas ka. Diba?
Ayan
Moon
po.
face, diba? So,
Si Doc Shell na po ang nagsabi, no? Kaya kayo cheeky. Ay, hindi dahil...
Hindi, cute ka lang. Ganun.
or kaya ka tumataba, hindi dahil sa steroids, malakas ka lang
Malakas ka talaga kumain.
Kasi New Year, Christmas, ang dami mong kinain.
Pero for sure, Doc, may side effects. Kasi gamot pa rin siya. So,
Gamot pa rin siya.
Kung hindi man yung chubby cheeks yung side effects na babantayan, ano yung mga like side effects na magandang bantayan din? Especially when you're taking inhaled corticosteroids. What are the more common ones?
The most common side effect of inhaled steroids it's called thrush. So it's like this parang, because, di ba, kahit na gaano ka pa kagaling, minsan, pag nagsisteroids ka, meron pa rin nagde-deposit ng mga particles ng gamot sa mouth mo, sa tongue mo. So ang nangyayari, parang it's fungus na nag-grow sa mouth. That's not naman common if you do it right. For example, you inhale well, you use a spacer for children, or what we tell people, you have to gargle or brush your teeth after you use it. So, mababawasan yung thrush. Yun ang pinaka-common. Some people, parang, sabi na na-irritate yung mouth nila, which is partly related doon. But in terms of systemic symptoms, kunyari, will it affect your liver or your kidney? Tataba ka ba? Tataas ba yung blood pressure mo or blood sugar mo? Extremely unlikely yun. But again, like all medicines, it's important to follow up. That's why yung mga doktor nyo rin naman, hindi rin sinasabi, no, etong gamot mo, sige, bye-bye, I will never see you again, parang ganon. Kasi, what if you don't need it anymore? Kasi, Jello's correct, medicines are medicines are medicines. And if you don't need medicines, why do you take it? Or if you don't need this much dose, baka pwedeng mas mababa. Kaya naman palang i-control. So, it's important to really follow up with your doctor para ma-personalize nila kung gaano kadalas mo kailangan, gaano kadami, what's your dose. So, it's important.
Yun. Kailangan talaga personalize dun sa ano.
Diba?
Ito, mag-change ako ng konti ng topic, no? Pero ito naman yung environmental control. Kasi sabi natin, di ba, factor siya talaga, nagiging trigger siya for asthma attacks. And siguro for Doc Shell and Doc Jello, sa inyo ko pareho, kasi expert. So, sa inyo ko to i-direct, no? So, ano naman yung mga non-medication strategies na pwedeng gawin ng mga tagapakinig natin? So, nag-intersect ang inyong field dito. Share naman kayo, anong mga tips nyo for us?
So, again, we said, one of the things that can trigger an asthma attack is exposure to things that you're allergic to. So, if you know that you're allergic to something, and there are tests to find out. So, kasi
Ito ba yung masakit na test?
hindi siya masakit.
Hindi ba?
Oo.
Okay.
Ano yun? Scratch lang yan. Or may
Akala
blood
ko
test na rin ngayon. So, may blood test na rin ngayon. So, by whatever way, if you find out what you're allergic to, if you can avoid it, that would be great. For example, pets. If you're allergic to pets, although that's a controversial thing,
Oo nga.
wala pa yata akong kakilala in my years of practice na nung nalaman nila na allergic sila sa pet, they voluntarily pinamigay yung pet. Parang never pa yatang nangyari sa buhay ko yon or sa buhay ng maraming tao.
Maggagamot na lang siya.
Maggagamot na lang po ako. So, yon. So, if you can avoid it, that's important. Or if you can minimize it. So, for example, you're allergic to dust mites. Diba? So, things that can accumulate dust, mag-i-increase ng triggers mo.
Ano yung usual example nun?
Stuffed toys.
Sofa.
Matandang, like an old mattress. Kung 20 years old na yung mattress nyo, it's time to
Palitan
change.
nyo na.
Oo.
Kahit buo pa.
Kahit buo pa. Lalo kung di ka allergic, okay lang. Parang ganon. Carpet. Yung mga dating, yung mga old school na drapes, yung ang kakapal na, yung mga
So, maraming layers.
Yung mga layers. Kasi
Oh.
hindi naman hinugasan yun eh. Di ba? Ang tagal maglaba nun eh. So, yun.
May
if you
dust
can-
mite din pala yun.
kasi nag-ano sila
May
eh.
dust kasi.
Magsisiksik sila doon. Old books, old magazines. Yung naka-stack lang, nag-accumulate ng dust yun.
Parang ano mga Time Magazine tsaka Reader's
Oh my God, Reader's
Digest.
Digest. The more dust, the more food for the mites. And the more mites, the more exposure you get. So, mga pillows, kung ang dami-dami yung pillows. So, kung kaya nyong tanggalin yung mga dust accumulating things in
Right.
your house. Humidity is bad.
Paano
Kasi
matatanggalin yun?
ito tayo medyo mahirap. So, kung bibili kayo, if you can afford it, and you can buy a dehumidifier, that's helpful. Kasi nga, molds and dust mites, very
Right,
prevalent
right.
sa atin.
Yeah.
And then, so those things, pwede. Washing your sheets. Sunlight is important. So,
Kailangan binibilad
biladin
nila.
nyo or buksan nyo yung windows nyo. Ay, windows, yung curtains man lang. Kung pollen, kasi medyo mahirap. So, kung pollen, kung may season, kung kaya mong iwasan, pwede. Staying indoors during the height of the pollen count, pwede yun. Jello had said earlier about pollution, di ba?
Right.
I mean, if you can get away with
How
that,
about
no
yung mga
smokers.
outdoor things naman, Doc Jello?
Pero
Meron din
I agree with Doc Shell. No? Parang the best approaches talaga are the simplest ones. Di ba? Like for example, simple cleanliness.
Yeah.
Di ba linisin yung bahay, yung mga sheets, yung mga surfaces sa bahay. I guess that can significantly reduce your risk, di ba? And then I guess like number 2 is ventilation talaga. Minsan nakakalimutan natin yung ventilation eh. Parang just ensuring na may inflow at outflow yung hangin para hindi naiipon or nagko-concentrate yung mga potential allergens sa ating mga indoor spaces. It's already something as simple as opening a window on 2 different parts of the house, diba? So, it doesn't need to be expensive, pero malaki talagang epekto. Pero, at the public health level, ang tricky kasi, Doc Sherry, kasi, you're dealing with an invisible killer.
Yes.
Diba? Kasi how are people supposed to know that, okay, I'm walking along BGC right now, or
And it's so polluted na pala.
Or sa Ortigas, di ba?
Ortigas.
Parang sabi
Or
na,
Katipunan.
Diba? Or I'm waiting, marami sa ating mga kababayang Pilipino, naghihintay ako sa MRT, tas isang oras akong nakapila, di ba? Parang how will I know na there's something bad in the air that can potentially trigger asthma or lead to negative health effects? And I guess this is really where the government comes in, di ba? We need to make an invisible killer visible.
Right.
Di ba? So, dito po sa Pilipinas, meron tayong tinatawag na Air Quality Index, no? Pero yun lang, sana mas, the Air Quality Index is a way by which, depending on the level of pollutants or bad things in the air, may different levels, no? Healthy air, unhealthy air, yung mga pag really bad yung pollution, dapat yung mga may asthma and other diseases, dapat ay hindi na sila lumalabas. Yun nga lang, medyo limited pa yung pag-disseminate ng information. Kasi alam mo, Dr. P, nung nagpunta ako sa Thailand, for example, or sa Korea, di ba, parang kadalasan nire-report yan. Alam yan ng mga tao di ba? Parang yung air quality ngayon, may mga app na nagre-remind sa'yo, makikita mo sa daan. Sana dito sa Pilipinas ay mas mapalawig pa natin.
Nung kabataan yata natin, meron nun.
Yes, dati nung bata ako, which was like, oh my God, we will age ourselves. Meron nun dati, meron parang red, green, and yellow na sign sa EDSA saying ano yung air quality at that particular time. Tapos nawala yon. Tapos wala na, hindi na siya bumalik. Pero that's important kasi, jealous, correct? Pag hindi ka mindful about it, pag hindi ka aware, parang sige lang, di ba?
Yeah.
But even though we can't do anything substantial at this point yet, pero pag alam lang ng tao, tingnan mo, ang pangit-pangit ng air quality natin.
Diba?
Parang ganun.
Yeah. And siguro ito tatanungin ko, no? Kasi 'di ba, minsan parang binabaliwala lang natin. But there are times na pwedeng emergency talaga.
Yes.
Yung attack or yung symptoms na nakikita natin. Meron ka bang tips paano natin malalaman na kailangan ko nang dalhin tong anak ko o yung asawa ko sa ER?
So, iba yung control. So, when you talk about severity of asthma, di ba yan yung control ng pang-araw-araw? Like, is it controlled? Is it not controlled? But attacks, even people who have mild asthma can get a very bad attack. Di ba? So, hindi porke, mild naman ako parate. So, hindi ako ever mamamatay or hindi magiging severe yung aking attack.
Kahit intermittent, pwede maging severe.
Pwede maging severe depending on the situation. So, for example, like say, one of the most common, speaking of like prevention also, you said it kasi, di ba, one of the triggers are allergens, and we talked about that, and environmental pollutants, and we talked about that. But actually, infection, viral infections, one of the most common triggers of an asthma attack. So if you get a bad virus, the flu, di ba, RSV, yan yung mga common na naririnig nyo ngayon sa news, di ba? Pag nagka-atake ka nun, pwedeng super severe yung iyong asthma attack. So, I guess segueing to that, if you get your vaccines, so advocating lang for vaccines, if you get your vaccines and you get protected from these viruses, one way din yun, ma-decrease yung possible triggers. But let's say you get the trigger, tapos, I guess look at your symptoms. very, very bad yung parang ginagamit mo na lahat ng muscles mo para huminga. Di ba? Parang,
Nakakapagod yun.
Oo, nag-flare na yung nostrils mo, tapos parang lahat ng muscles mo ginagamit mo ng huminga. That's not a good sign. If you can't talk, kunyari hindi na siya makasalita, kasi hindi na siya maka-complete ng sentence, that's not a good sign. Diba? Okay. Or, syempre, I mean, if you're an older child or an adult, pag sinabi, hindi ako makahinga, that's always a bad sign. So, those are things that might tell you na parang, hindi na enough sa bahay lang to. Baka dapat pumunta na tayo sa ER or sa emergency department. You can certainly use your rescue medicines at that time. Mm-hmm. Kaya nga sinasabi nung doktor, di ba? Kaya nga rescue. Mm-hmm. Pero pag ginamit mo yung rescue mo, after 20 minutes, kailangan mo ulit yung rescue mo. After 20 minutes, kailangan mo na naman ng rescue mo. Parang back-to-back rescue medicines. Baka dapat go to the ER na yung mga times na yun.
So, ilang beses ka pwede mag-rescue?
Maraming beses. Pero kunyari, kahapon wala kang rescue. Ngayon, nakakatatlo o apat ka na.
Pang-ER na yun.
Baka dapat either you call your doctor at the very least. The very least, call your doctor. Or if you can't contact your doctor, at the very least, have somebody see you. And that's usually the emergency room. Or in kids, syempre, di ba, parents, mas worried man yan. Generally, pag medyo sanay na yung parents at nare-recognize na nila yung signs and symptoms sa anak nila, parang sanay, di ba? Alam na nila eh. So, mas malaki yung chance parang, I can bring my child to the ER or maybe not. Yung mga bagong parents or bago yung anak nila na diagnosed with asthma, syempre, mas less sanay sila, they're more worried. I don't think there will be anything wrong about calling your doctor, going to see them. If it's good, then the doctor will say, okay pa ho yan. At the very least, diba? Somebody takes a look at your child. So I think it's important.
Ito, Doc, I'm sure you get this question a lot, no, with your patients. But I'm sure a lot of parents or patients would ask, can my asthma be cured? Or is there hope for me to live a normal life, like exercise or do swimming? So, parang, can I exercise? And most importantly, can it be cured in its fullest sense?
So there's no cure for asthma. Kasi nga we said, partly genetic, partly the inflammation in your lungs, and the kinds of inflammatory cells that you make dictate that you have asthma. And we cannot change that. But when people say, but it's true they say, di ba I've outgrown? Di ba narinig yun all the time? Nung bata ko, may asthma ko, tapos na-outgrow ko siya. That's still not quite a cure kasi that would mean that you took away all your genetic, parang minutate ka natin to get rid of the disease. But that just means that you've gotten so amazingly better na wala ka ng symptoms of asthma regularly. But can you get like an attack? So kunyari, when you were a child, you really had asthma, you were diagnosed, it truly was asthma. Hindi lang yung, batang-bata ka, nag-wheeze ka one time. Totoong asthma. Tapos siguro mga teenager, by the time I was 12 or 13, wala nang atake until 30 years old ako. If I'm 30, can I still get an asthma attack? It's less likely, obviously. You haven't had an attack in forever. But is it possible? I guess it's possible with the right, like I got a bad virus, somebody smoked beside me, I was trapped in a moldy place. I guess you can get an asthma attack. But so it's not curable. But it's controllable. Speaking of like, can I live a normal, happy life, active life?
And exercise kasi alam ko sa school maraming mga teachers nagsasabi, bawal ka mag-swimming. And syempre yung mga kids gusto na mag-swimming.
In fact, the goal is for you to be able to do everything else that other people can do or everything that you want to do.
Right. Walang restrictions.
Without feeling short of breath or limited. But that's why it's also important to get good control. Kasi kung wala kang control, may hirapan ka naman talagang gawin yung dapat mong gawin. It's also hindi na acceptable when people say, and I'm sure there's some issues about this, yung parang, Doc, paki-excuse naman yung anak ko. Or paki-excuse naman ako kasi ayokong mag-PE or hindi ako pwede mag-PE. The idea is bigyan ka ng gamot para makapag-PE ka. Diba? Parang ganun. Ganun yung idea.
So asthma is no longer an excuse.
No, it's not.
Hindi
It's
siya
not.
excuse talaga sa mga excuse letters.
Pag nagka-atake ka, excuse.
Okay, pag may
Pero
atake
like
lang.
to limit
Yes.
limit the activities that you do. Like swimming, for example, is a great exercise. The evidence for exercise making your asthma better is limited, but the caveat is very strong. If you have a sedentary lifestyle, if you don't move, walang cardio, super taas ng evidence that your asthma is harder to control.
Yeah.
So the corollary, I suppose, like if you move, if you exercise, then it's much better.
Right,
Pero bad ang
right.
sedentary lifestyle.
Yeah. Doc Shell, so maraming salamat talaga dun sa ang dami-dami mong na-share ngayong gabi, no? Pero siguro bago ka namin pakawalan, meron ka bang message para sa ating mga listeners? Like, ano yung takeaway talaga? Kung meron kang one thing na gustong takeaway ng ating mga tagapakinig ngayong gabi?
I think the most important thing is that asthma shouldn't be a limitation to do whatever you want to do. I think that's the most important. I think that's true for any chronic disease. Diba? The goal of asthma, kasi marami nang nagkaka-asthma ngayon, diba? So parang, paano na yan? How is my lifestyle? I mean, the goal is clear. It shouldn't restrict what you can do. It shouldn't limit what you want to do. If you want to be an athlete, if you want to be a singer, if you want to be the president of the Philippines, you should be able to do all of these things. Granted, there's a little bit more involvement, like you might need to take your medicines, you might need to do certain things in your home, but the goal is for you to live a fruitful, productive life despite the disease. It's also not just you, and again, going back to Jello's point and Tippy's point, I think it's also important to look at external factors. Asthma is not just a personal thing. In fact, it should be a public health thing, diba? Because it involves so many layers of how you control it, how you diagnose it, how people can live a really functional life. And if we don't take care of that, kung puro lang, patient lang, it's a disservice to our patients. But we need to talk to other people, diba? Government, diba? Other institutions.
And I guess parang to that point, I think there's room for solidarity here. Kasi when we talk about asthma control, it's not just the responsibility of those with asthma. Everyone, even those without asthma, we all have a social responsibility to make more livable environments, no? Environments that make it easy for everyone, whether you have asthma or not, to make it easy for you to breathe. Kasi karapatan po ang malinis na hangin.
Yes.
At huminga.
Karapatan po natin na huminga. So, whether it's about, making sure na we try to minimize or eliminate smoking, di ba? We promote sanitation, we promote workplaces and schools, di ba? That make it easy for those with or without asthma to breathe easier. It's everyone's responsibility, and we're all in this together. And most importantly, hindi po nakakataba ang students.
Oo nga.
Dr. P.
Yes, so sa ating mga listeners ngayong gabi, if you have symptoms like chronic cough, wheezing, shortness of breath, or tightness talaga ng chest na, no, please see a doctor and don't dismiss it na kakayanin mo yan, tiisin mo lang yan. And if you have been diagnosed to have asthma and you still struggle with symptoms, you deserve better control. So, seek a specialist po na kagaya ni Dr. Shell.
And wag magtitiis. Alam mo, Dr. P, ang ganda ng conversation natin today, pero maganda rin yung conversation natin next week. So next week, we'll be talking about functional medicine just in time, no, for our functional medicine conference on February 6 and February 7. Napakagandang conference po niyan. I hope those who are interested, no, you don't need to be a health professional to attend. Please register po, no, sa ating Functional Medicine Conference brought to you by the Ateneo School of Medicine and Public Health and Ateneo Center for Research and Innovation.
Yes. And until then po, until next week, breathe deeply, take care of your lungs, and remember, every breath matters.
I'm Dr. Jello Apostol.
And I'm Dr. Tipi Sumpay-Kotanchanko.
And from Cura, stay healthy, Ateneo!
Magandang gabi po!
Isn't just about medicine.
It's about care
Community
and conversation. That's why Radyo Katipunan brings you Cura, your campus medical show.
From everyday wellness tips to expert advice on the health issues that matter most to you.
Cura is here to listen, guide, and care
The Ateneo way.
Join us as we talk about healing,
Hope and health right here on Radyo Katipunan 87.9 FM.
Cura, your campus health companion
Where care meets conversation.